Welcome to the Department of Family Medicine and Continuing Care. I'm Dr. Lee Keng Hock, the head of department. At FMCC, we provide comprehensive and continuing care to our patients from the hospital to the community and back to their home. This video will feature many of my doctors and the interesting things that they do and our commitment to patient-centered care in this hospital.
At SGH, we have opportunities to provide holistic inpatient and post-discharge care for our patients. There are also exciting opportunities for medical education and research. Our integrated clinical care service provides comprehensive inpatient care for our patients who are at high risk of readmission and have complex care needs. We'll review their medical conditions, execute good discharge planning, and integrate them back into the community. This is possible with our multidisciplinary team, our nurses, pharmacists, and social workers. Our nurses will educate patients in disease management, our pharmacists will assist with medication reconciliation, and our social worker will activate social resources for our patients. After our ward round, we'll gather as a team again to discuss about patients who are discharged back in the community. Through regular phone calls, our integrated care nurse will identify problems early, and our doctors will review this patient in our early review clinic and also in their home.
FMCC has been running a transitional home medical care program since 2002. We are unique in the sense that we provide a multidisciplinary care directly to our patients' homes once they're discharged from hospital. In the home setting, we stabilize our patients' subacute and chronic medical conditions, as well as empower them and their caregivers with the necessary skills and knowledge for self-care.
我从医院回家 ，Dr. Tan 护士来看我，来鼓励我。
Bright Vision Hospital is a 318-bedded hospital that provide continuing care and rehabilitation service for patients that requires further rehabilitation and improvement in their ADLs actually after discharge from the restructured hospitals. We try to improve the patients' ADLs and improve their confidence so that they can function as good as possible back in their own home.
FMCC also has a preventive medicine arm. At the Health Assessment Center, well patients are seen for screening for silent disease. Subsequently, they are offered disease education as well as coaching in lifestyle changes. When you are posted to the Health Assessment Center, you will be trained in skill sets to empower patients effectively for lifestyle change, which is the way to go to reduce disease burden and health costs in Singapore. So I'm personally very happy to see many patients who successfully lose weight or reduce cholesterol levels after my encounters with them. Our department has a strong academic medicine record. Most of us hold faculty positions in the SingHealth Family Medicine Residency Program in Duke NUS and Yong Loo Lin Medical Schools, and we also train family physicians under the College of Family Physicians. Like most of my colleagues, I spend a significant amount of time training residents and medical students attached to our department. More importantly, we have a structured training program to train our medical officers to be competent in complex care so that you can be versatile in any family medicine setting in Singapore.
Being an academic family medicine department, FMCC is actively involved in research to improve patient outcomes. We collaborate actively with researchers from the Singapore Clinical Research Institute as well as Duke NUS University. In FMCC, you can look forward to the experienced mentorship when you take on research projects that will improve patient outcomes and shape the way healthcare is delivered in Singapore.
No, of course not. So I was actually lucky enough to work in family medicine, and during this time I found that we're more like one big family. Even our seniors, they get to know us, they take a lot of time out and talk to you, find out what you like, and I think this actually translates down to the junior staff, and we end up being very close. We go out for makan sessions, go out for movies, and we actually celebrate each other's birthdays together.
I came here to Singapore like 5 months ago. My initial apprehension proved to be wrong, and it was later changed to the warmth and collegiality of my colleagues here. They helped me to settle in quickly, and we soon became close friends.
I actually discovered that there's more to family medicine than what everyone thinks. You know, it's not just being in a GP clinic. I think as a young doctor, you don't really realize that. I started in SGH, and then you see patients there and you send them either home or to Bright Vision for rehab. After they stay here for a couple of weeks and they go home, you know, I actually feel really confident that, oh, you're going to make it at home, you're going to be fine, you know. I think that was that was really fulfilling for me.